Assalamualaikum. I am Dr. Nafia, lecturer, Department of Pathology, Bashundhara Ad-din Medical College. Today I am going to discuss about an important pathological condition of gastrointestinal system, which is inflammatory bowel disease. What is inflammatory bowel disease? Inflammatory bowel disease is a chronic condition resulting from complex interactions between intestinal microbiota and host immunity in genetically predisposed individuals, resulting in inappropriate mucosal immune activation. It is most frequently present in the teens and early 20s but can develop at any age. The two disorders that comprises inflammatory bowel disease are ulcerative colitis and Crohn's disease. The distinction between ulcerative colitis and Crohn's disease is based on the distribution of affected sites and morphologic expression of disease at those sites. Ulcerative colitis is more common in non-smokers and Crohn's disease is more common in smokers. Ulcerative colitis and Crohn's disease both are associated with genetic variants at HLA locus. Crohn's disease is associated with genetic defects in innate immunity and ulcerative colitis is associated with genetic defects in barrier function. Here is a figure showing the systemic complications of inflammatory bowel disease. There are some differences between Crohn's disease and ulcerative colitis, which are Crohn's disease can involve both ileum and colon, but ulcerative colitis can involve colon only. The type of inflammation is transmural in Crohn's disease, but limited to mucosa in ulcerative colitis. There are skip lesions in Crohn's disease, and the type of lesion in ulcerative colitis is diffuse. In Crohn's disease, we can find non-causating granuloma, and which is absent in ulcerative colitis. Ulcerative colitis is closely related to Crohn's disease, but its intestinal involvement is limited to the colon and rectum. Disease of the entire colon is termed as pancolitis, and disease limited to the rectum may be referred to descriptively as ulcerative proctitis. Clinical features of ulcerative colitis. Ulcerative colitis is a relapsing disorder characterized by attacks of bloody diarrhea with expulsion of stringy mucoid material and lower abdominal pain and cramps that are temporarily relieved by defecation. These symptoms may persist for days, weeks, or months before they subside, and occasionally the initial attack may be severe enough to constitute a medical or surgical emergency. Here is the figure showing gross pathology of ulcerative colitis. Crohn's disease. Crohn's disease, also known as regional enteritis, may occur in any area of the gastrointestinal tract, but the most common sites involved at presentation are the terminal ileum, ileocecal valve, and cecum. The presence of multiple separate sharply delineated areas of disease resulting in skip lesions, which is characteristic of Crohn's disease, and may help in differentiation from ulcerative colitis. Non-causating granulomas is a hallmark of Crohn's disease, which are found in approximately 35% cases. Clinical features of Crohn's disease. The clinical manifestations of Crohn's disease are extremely variable. In most patients, disease begins with the intermittent attacks of relatively mild diarrhea, fever, and abdominal pain. Approximately 20% of the patients present acutely with right lower quadrant pain, fever, which may mimic acute appendicitis or bowel perforation. Patients with colonic involvement may present with bloody diarrhea and abdominal pain. Here are two pictures showing the gross pathology of Crohn's disease. Complications of inflammatory bowel disease, which are a hemorrhage, fistula, life-threatening colonic inflammation, and development of neoplasia. Investigations. We can do the following investigations, which are bacteriological investigation, endoscopic examination, and radiological investigation. Management. Drugs that are used in the treatment of inflammatory bowel diseases are aminosalicylates, which are mesalazine, sulfasalazine, etc. Glucocorticoids such as prednisolone, budesonide, etc. Methotrexate, cyclosporine, anti-TNF antibodies like infliximab, antibiotics, and some antidiarrheal agents like loperamide. Surgical treatment. Up to 60% patients with extensive ulcerative colitis eventually require surgery. The indications are failure of medical therapy, fulminant colitis, and colon cancer, etc. The indications for surgery in Crohn's disease are similar to those for ulcerative colitis. Operations are often necessary to deal with fistula, abscess, and perianal disease. That's all for today. Thank you.